This is deep cervical neck flexor training. The deep cervical system, longus capitis, longus coli, run deeper than all the superficial cervical musculature that we can see. Deep to anything that's visual. This is the true core of the neck. You have two thin, sheet-like, ribbon-like muscles that go against the spine itself. We need strength from these muscles. We also need stamina and endurance. The system will be getting us out of the consequences of forward head posture, which also encroaches on upper cervical dysfunction as well as headache. So the retraction movement here is really the key to firing this tissue. So we'll take the athlete on their back. You'll find also that it'll probably be easier to perform this series without a pillow because it'll be a little too distracting. So we'll lift and support her, kick this out, and she'll come back on her back. So the first thing to work on is, how do you know if you're firing these muscles correctly? This series has a low compliance because people get frustrated because they don't know if they're actually firing correctly. So when you go into this retracted position, one thing to also think about, not only is it a chin into the throat, it's also an elongation and almost sliding the skull backwards as you do it. So it's in and then back. So getting a couple reps there as practice is recommended. And rest. Now, what's very important here is, how do you know if you're going back to using the bad team, so to speak? So these external tissues are going to try to be bullies, and they're going to try to essentially perform the movement themselves, keeping that deeper system weak and inhibited. So the patient can take their own hands and palpate. Go ahead and kind of replace my fingers. These big sternocleidos occipitomastoid muscles. So if she removes one hand, what you'll see here is that from the clavicle, from the collarbone itself, you'll see this nice large ribbon of muscle here. So the hands are going to be placed 2 fingers lightly on that tissue on both sides. So then now she's going to perform that same kind of tuck elongation on her own, palpating to see if she feels contraction of those muscles. The goal is that you can perform that movement maybe a little bit less intense, maybe a little bit smaller, a little bit slower. You want to work through that full range, hoping not to feel contraction under her fingertips. Once she feels like she can get into that movement without feeling that muscle increase in size or get more rigid, then she can relax her hands and now work on a tuck hold. So now we'll go into the stamina and endurance aspect. So she's going to tuck, elongate, and hold, trying to stay nice and relaxed in the throat the whole time, giving it a 10-second count, easing on slowly, and then easing off slowly as well, and relaxing. And so one more time, elongation, tuck, trying to be cool and relaxed. One thing that also really helps here is to find the sternal point. The xiphoid bone is the small arrowhead at the very bottom of the sternum. So that'll be right here, and she can work to pin that down as she tucks as well, which will give a greater communication of the neck core, if you will, connected to the deep central core. Okay, and then relax. Now, the third phase is pretty advanced here. We're going to remain calm and cool in this neck tissue. We don't want these bullies firing again, right? So we're going to tuck, elongate, and then try to lift the head only high enough to slide a magazine under the skull. Just there. Any time domain is a positive thing here. Go ahead and relax. You can see, even as for a fit young athlete, there's still shake, there's still strain, it's still pretty challenging to perform, right? And then we talk about any time domain being advantageous. The temptation, the longer you hold, remember these tissues are likely weak and inhibited, you're more likely to go back in and bring back in the big bullies. So you're going to be very sensitive and wait till you feel like you're actually ready to advance to this final position. It could be a 5-second hold, it could be a 2-second hold. The time domain is dictated by how isolated you're actually performing it and not requiring the big guys to come and save you. Okay? So this is cervical deep neck flexor kind of training 101. This is where it starts.